Hi everyone, this is Dr. Ty Vincent making an LDI video about treating dairy allergy. Dairy allergy is actually quite common among humans. We're mammals and we're meant to drink milk, but it's human milk, obviously, and only for the first couple of years of life. And then it's actually the natural state for human beings to become lactose intolerant by age 4 or so. The significant majority of human beings on the planet are naturally lactose intolerant. And that's one of the things to explain the difference for people between lactose intolerance and dairy allergy. You can have the exact same symptoms, but one is immune mediated as an allergic reaction, the other is just a digestive physiological phenomenon where if you consume dairy that still has lactose in it, right, you don't break down the sugar, you don't digest it anymore. So what happens is the gut bacteria that you possess will break it down for you, but they will break it down through the process of fermentation. Fermentation creates gas, and it also just separates the sugar into two molecules that you may or may not be able to absorb effectively. And so what happens is you get bloating, gas, and diarrhea in most cases. If those are the three symptoms you get when you consume dairy, then you may not be allergic, you may just have lactose intolerance. The easy way to tell the difference is to take the Lactaid capsules that are available everywhere when you consume dairy, or buy some Lactaid treated milk at the store, they sell that, and see if you respond to that the exact same way that you respond either without the Lactaid or to the regular milk. And then you can tell, oh, I just have lactose intolerance, and then you don't need to call me because I can't fix that. You'll never tolerate lactose again naturally. You can only consume dairy products that contain lactose if you also take Lactaid. That's it. You can have both problems, of course. So if you get any other symptoms from consuming dairy aside from bloating and gas and diarrhea or softer stools, cramping that goes with that and whatnot, if you get other symptoms besides that, anything in the mouth at all, itching in the mouth or throat, sinus congestion, itchy ears, migraine headache, anaphylactic shock, that one's obvious, eczema, itchy skin, joint pain, of course, anything else besides those core lactose intolerant symptoms is an allergy. It's an immune-mediated response. And those are the things that we can get rid of with LDI, and they're with a very high degree of success. Dairy allergy is quite easy to treat. It's usually very straightforward and obvious when people have it. You go off of dairy for a week or so, everything's cool, or those symptoms don't occur at least, and then you consume dairy, and you get symptoms, usually within hours or minutes sometimes, and sometimes it's a day later delay for people, and that can be harder for them to determine. It's also important to point out that you can react to some kinds of dairy and not others, because dairy products are a category of food. I think they get their own box in the food pyramid, right, if you still believe in that, the food pyramid. So there's straight milk, right? And that's one thing, that's the pure dairy form. But then there's yogurt, which is somewhat cultured by bacteria, and the proteins are somewhat modified. There's also usually less lactose. So a lot of people that are lactose intolerant will have the worst problems with milk or cream-based soups or sauces, right? Have heavy cream in them. But they'll do better with yogurt maybe, and they'll do much better with cheese, maybe not react to cheese at all, because cheese, in most cases, really doesn't have lactose in it at all anymore. So if you react to cheese just as badly as you react to milk and yogurt, or in some cases people can react to cheese when they don't react to milk, which is unusual, but I've seen that in a number of people as well. The modifications of the proteins through the culturing process, becoming milk, kefir, yogurt, cheese, all different varieties of cheese, you can react to some of those things and not others based on the antigenicity and the way it's been modified by microorganisms. So it's not usually, well, not always, it can be, but it's not always a homogeneous kind of response pattern that you'll get to milk, yogurt, cheese, whatever, ice cream. It may be diverse. And one of the things you need to know before you try to treat the allergy is how you react to those different things. You need to know which ones definitely cause reactions so you can use those as test foods. If you have a very severe reaction to dairy, or your child has a very severe reaction to dairy, including life-threatening responses, you can still treat them with LDI, and it's actually a very important thing to do to eliminate that allergy so you don't have to live in constant fear of milk exposure killing your child or yourself. And in most of those people, I don't think I've encountered anyone yet where this isn't the case. They will also have a skin reaction on contact. If you have an anaphylactic level response, if you put the stuff in your mouth, virtually everybody, and I'm sure there are some people where this isn't true, but the vast majority of people will put some on their skin and exhibit a skin response where there's itching and redness and things of that nature. So when we have that as a tool, we can go through the LDI or desensitization process with whatever technique you want and use your skin response as a guide for success or failure after any individual dose, and then you know whether it's working or not, and you can get to the right dilution for that person without having to risk oral exposure, which is really nice. So that's something that's helpful to know before people talk to me as well. Oh, my child does have a skin reaction, and if you do the test at baseline, the two things to record are the time it takes to react, and then wash it off with soap and water and record the time it takes for the skin to be normal again, the redness and itching to go away. That's all very helpful. Other nuances about treating dairy allergy is that it's oftentimes accompanied by other food reactions people have, right? Most people with one food allergy have others. But dairy is one of those categories where it's not unusual for someone to require a totally different dilution antigenically, for the dose, for dairy than they do for all of their other foods. So we have a dairy category that I made separate that we can break out and give at progressively stronger dilutions. It's usually been the case that they need a stronger dose for dairy than they do for other foods. So we use the whole food mixture and move it along until all of their other food reactions seem to go away, but they still react to dairy to some extent. It's a pretty common scenario. And then we just add the dairy subset at increasingly stronger doses until we get that under control too. Another thing to understand about dairy is that the vast majority of dairy products on the market, commercially available, will have corn in them because the cows are usually fed corn. If you are allergic to corn and you have pretty much the exact same set of symptoms to corn that you do to dairy products, then you might just be allergic to corn and might not react to dairy at all. And that's something to sort out. You can have grass-fed dairy products. So there's grass-fed milk available on the shelves, or you might know somebody locally who produces milk. And if you don't react to the grass-fed dairy at all, but you react terribly to regular mainstream dairy, then you're probably just allergic to corn or some other thing that they feed the cows. So that's an important thing to understand, the distinction as we go through the process. The other thing is whether or not you react to other mammal milks. So goat's milk is readily available in a lot of places. Sheep's milk and certain cheeses are made from sheep's milk. Sometimes people can tolerate those and they can't tolerate cow's milk. 75-80% of people tend to cross-react. I have not encountered somebody yet who's allergic to goat milk or sheep milk or something and not allergic to cow's milk, but that didn't respond to LDI, I guess, is the end of that. So LDI with the milk, which is all we put in there was cow's milk and a variety of cheeses and yogurts and whatnot, has so far cross-reacted with the other mammalian milks. The one I'm not very sure of is camel milk. Some people out there, their child is on camel milk and they drink that. Maybe you're allergic to camel milk and you want to be able to consume it. Haven't really encountered that yet, but it's not a very common dairy product to be consumed, and it's also exceedingly easy to avoid. If you remain allergic to camel's milk, you don't really have to live in fear. You're not likely to accidentally come in contact with camel milk. So I think those are the highlights of dairy allergy. It's something that's extremely common in the population. It's extremely treatable with LDI and other desensitization techniques. But LDI works really well the way we've designed it, with all of the different kinds of cheese and everything put directly into the mixture. And it's something people don't really have to have. So if you or somebody else has a dairy allergy and you'd like to not have a dairy allergy, we can take care of that.